Hi everybody, Dr. Olivia Joseph of Dr. Olivia Naturals here, and I got the best question ever in our closed private Dr. Olivia Naturals VIP group. So just so you're aware, within that group, people post their question weekly, and once a week I hop on for a live FAQ where I answer all of those questions personally. It's a very efficient way for me to answer questions personally, and it's also an opportunity for other people to get educated on a variety of topics. When we do these videos here at Dr. Olivia Naturals, we always go deep on one topic. That we're staying on the surface for many topics, and we're in there weekly, and those videos average about 30 minutes. So you're welcome to hop in there, post your questions there. But within that group, I got a question that deserved going deeper that I wanted to share my resources with. So this is somebody who has a lump in their breast, and for this person, it was recommended that they go on a prescription medicine called tamoxifen, which is used for people who've had hormone-positive cancer or for people with certain risk factors. But this person in particular can't really take it or doesn't want to take it because the potential for cardiovascular side effects, because this person has cardiovascular disease. So I completely get your concerns. So let's talk a little bit about estrogen. Estrogen's a good thing. We have estrogen receptors on our brain. We have estrogen receptors on our bones. So what I will say is, we have to be careful of dangerous estrogen, which is known as xenoestrogens. These are some of the estrogens we get exposed to in water, through plastic bottles, leaching these xenoestrogens, and from food sources. So these are synthetic sources of man-made and dangerous estrogens. But we also get exposed to dangerous estrogens if you have ever taken hormone replacement therapy. Birth control isn't just synthetic progesterone. Virtually all birth control also has synthetic estrogen. And there is such a thing as hormone-positive cancer, estrogen positive, as well as progesterone positive. This talk isn't about cancer, but just to give you a little background, my mom was first diagnosed with hormone-positive cancer at age 35, and it was ovarian cancer. That's a really bad one. She then went on to have cancer a total of 5 times in 15 years, all hormone positive. I'm happy to say she's been in remission, complete remission, for almost 14 years, 13 years. So the story has a happy ending and a silver lining. Her sister also had breast cancer. And so they were tested for the BRCA gene. Guess what? They didn't have it. There's obviously a genetic component. So what is it? We're not going to go deep into genes. I have so many videos out there on genes, so many videos out there on detoxification. This is very specific to detoxifying estrogen out of your body, or estrogen dominance, which I will define for you. So what they do have, and the reason I know they have it is because I have it, right? Is a COMT gene mutation. This is a gene mutation that does affect methylation differently than MTHFR. MTHFR affects methylation and can cause high homocysteine, can cause blood clot, stroke, dementia, infertility, secondary infertility, and miscarriage. That's MTHFR. COMT is part of the methylation pathway, but what it works to do is detoxify dangerous estrogens. So people who are estrogen dominant may have mild symptoms like, I can't lose weight and I don't know why. I store fat in my arms, in my back, in my breast tissue. I have very large breast tissue because that's where these estrogens like to hang out, right? So even you'll see sometimes when you take hormone replacement therapy, or if you're pregnant, that you start storing fat in these areas, right? Your breast tissue enlarges, you have more fat in your arms, fat in your back. Question here, is it possible to have both? Yes, and I see that all the time. I see people who have MTHFR and COMT, and I could probably do a separate video on that. I should do a separate video on that, but if you watch my 1-hour training that I was hired by a company to train physicians on MTHFR, and I'm actually doing another training in July for another group of healthcare providers, and next year I'm speaking at a fertility conference on MTHFR. When I teach on MTHFR, I always bring awareness to COMT as well. So People with COMT and MTHFR sometimes don't do well with methylcobalamin and methylfolate. Sometimes you have to use something called tricobalamin, which is a combination of adenosyl, hydroxy, and methylcobalamin before you can ever add folate. Some of those people tend to really have mood issues in which they might do really well on SAMe. And then some people do terrible on SAMe. This isn't to talk about what supplement to take. It's really about root cause. What are your predispositions and what is your chemistry? So back to estrogen dominance. So when you don't detoxify estrogen properly, it becomes trapped in fat and glandular tissue. You cannot identify that through blood testing. You can have 10 to 50 times more estrogen in fat and glandular tissue than you actually have in your bloodstream. Postmenopausal women getting hormone positive cancer is on the rise. Women getting hormone positive cancer after a hysterectomy on the rise. I'm going to go back to my mom as an example. Her ovaries were removed at age 35. There goes your hormones, but yet she still went on to get breast cancer, uterine cancer, all hormone positive cancers. So what we're seeing is this rise in hormone positive cancer in postmenopausal women, which didn't used to happen. And it has a lot to do with our bodies not detoxifying estrogen properly. So let's just briefly talk about testing and detoxification, and then I'm going to give you specific things to estrogen, okay? Testing. My favorite test I've used for 15 years in practice is saliva testing, but urine testing is better for checking estrogen detoxification. Let me tell you why. It's called a Dutch hormone test, and to be very specific, Dutch complete. The beauty of it is you can order your own testing. The only thing I'll warn you of is you will not know how to interpret it. I promise one of these days, shortly in the near future, I'm going to record a video on how to interpret a Dutch test. Really, you should work with a healthcare provider to interpret it. It's an easy test to order on your own, but it's not an easy test to understand. Believe me, I said this to the doctors who were training me on it, and now that I train doctors on it, it's not super simple to interpret. But the beauty of it is there's a pie graph, and it breaks your estrogens down to good estrogen, neutral estrogen, and dangerous estrogen. And you want to make sure that that dangerous piece of the pie is a small piece of the pie. So it shows you not just what the total estrogens are, but how much dangerous estrogen is really in your body. Then it also checks your methylation pathway, regardless of if you have MTHFR or COMT. The question is, where can I order that test? You can go to Dutch and order it yourself, which is Precision Labs, or I do have a link at drolivia.com. Click on lab testing, and you can order your own Dutch complete test right then and there. If you go to the Precision Labs website, they have a lot of testing. I don't want it to be confusing for you. At drolivia.com, I have selected the labs that I use most commonly with my clients and within my practice. So you can order your own stuff direct to consumer, but you see this estrogen piece of the pie, so you can see how well your body's detoxifying estrogen and methylating regardless of gene mutations, but you can also see what percentage of your estrogens are dangerous. And we all have them. We all have dangerous estrogens. That's why our bodies have detox systems. So what can we do to detoxify these dangerous estrogens? Well, as you guys know, I'm huge on detoxification. And if you do have COMT gene mutation, I recommend you detox at least once every 6 months. I have this gene mutation. I detox on average every 3 to 4 months, because what happens when I don't detox that regularly, I store fat in my arms, in my back. I've got a heck of a family history. Now, thankfully, I've never had other symptoms of estrogen dominance, and I believe it's because I live a very healthy lifestyle. I eat clean, I detox, I exercise, and at the end of the day, if you have endometriosis, heavy bleeding, fibroids, those things are driven by an estrogen dominance. It's not just about hormone positive cancer. Those things are signs and symptoms you may have an estrogen dominance. So an estrogen dominance is either when your progesterone is too low and your estrogen is dominant because of that, or because your estrogens are actually higher than they need to be, and then we want to figure out why. So exercising, specifically sweating, detoxing, doing a sauna, an infrared sauna, Epsom salt baths, anything that can make you sweat is going to help you detox dangerous estrogens. We have research that shows as women lose weight, their risk for hormone positive cancer goes down. Why? Because that's where we store this excess estrogen in fat and glandular tissue. The other thing we have research to support is eating cruciferous vegetables decreases your risk for hormone positive cancer. Why is that? Because of the indole-3 carbinol found in cruciferous vegetables. So indole-3 carbinol is something that's found in cruciferous vegetables, and it actually helps your body detox dangerous estrogens. So if you eat like 2 cups a day of organic cruciferous vegetables, you're gonna be consuming a beautiful amount of this indole-3 carbinol. You do that, you detox periodically, you exercise, you sweat, you keep your body fat at a healthy weight, do up some salt baths. These are all things that are going to help. There is a supplement that I use quite a bit for estrogen dominance, and I've personally taken it, called CDG Estro Dim, and this has calcium D-glucarate. Calcium D-glucarate binds to unbound estrogen in the bloodstream. So it's only dangerous if it's unsupervised. So the calcium D-glucarate helps bind to those free estrogens. And then there's something called DIM, which is, if you do your research, has been used for a long, long time to help with estrogen dominance and to help with estrogen detoxification. So this is probably one of the strongest formulas because it has the calcium D-glucarate and the indole-3 carbinol and the DIM all in one product. And it's probably the one I use most commonly. So this is to help you understand the whole estrogen dominance, estrogen detoxification, gene mutations, testing, to help you take your health into your own hands. Because I'm not gonna lie, I was in my early 30s and I went to my well woman exam, and I remember the doctor said to me, "Are you done having children?" And I said, "I don't know. Why? Why do you ask?" And she said to me, "With your family history, if you're done having children, I think it would be a good idea for you to have a hysterectomy and a double mastectomy, and we could probably get your insurance to cover it." I was blindsided. I left the office and I was angry, and I ended up crying, and I was like, "You're gonna take out my parts? That doesn't make sense." Well, her reasoning behind it was my family history. And she said, "Surely it's genetic." And I said, "Yeah, I get it, but they haven't found a gene that caused my mom or my aunt's cancer. They're both BRCA negative. So there has to be a better answer." So what I did was a very, very, very expensive genetic test that I've done on my patients. It's done by a lab called Genova, and it's an estrogen detox genomic test. And I was testing all of my detox pathways for specifically to estrogen. And for me, it was worth every penny because I got answers. I saw what I had. I didn't have MTHFR, I do have COMT. And the more I've studied gene mutations and COMT and all this fascinating stuff, I realize our genes are not our destiny. They're not. My mother's lifestyle was very, very different than mine. My aunt's lifestyle is very, very different than mine. So I don't want to live in fear and take out my parts, because I'm going to tell you something. If you go into menopause too early due to chemical menopause, which is when you induce menopause, due to endometriosis or PMDD, or that's the most common 2 reasons why you would do that. When you do that, or when you have a hysterectomy and remove your ovaries, there's now data to support, as we've been doing this in younger and younger women over the last 10, 15, 20 years, what we're seeing develop is cognitive decline at an earlier age. So it's actually affecting your brain function. They're finding a lot of these women are developing dementia at an early age because we have estrogen receptors on our brain, okay? So when you just start blocking your hormones, there's always gonna be a consequence. I get you're doing it to prevent hormone positive cancer, but at the end of the day, this person asked me, how do I block estrogen? There's no such thing. even using drugs or medications like tamoxifen, even having a hysterectomy and removing your parts, you cannot block estrogen. You can take a man, check his estrogen levels, and he will have estrogen. He will. We have more, but they also have estrogen because you've got your pituitary gland on your brain regulating hormones that works with your adrenal and your thyroid. We are equally exposed, men and women, to xenoestrogens, which are estrogens within our environment. So it's so important that we focus on detoxing estrogen and not putting synthetic toxic estrogens into our body, because we know when we started using hormone replacement therapy, there was a huge rise in hormone positive cancer. So that's my 2 cents on answering that question. As always, it's an absolute pleasure bringing this information to you. Feel free to post in the comments anything you'd like to see more expanded videos on. Some things we have in the hopper are Lyme disease, mold toxicity. Those are definitely in the hopper. I have so much content out there on thyroid, guys. The most recent podcast I was interviewed on thyroid is so fun and exciting because I could talk about thyroid all day, every day. Upcoming in June, I am teaching, I'm training physicians on how to reverse type 2 diabetes. So I do a lot with blood sugar, and I talk a lot about the root cause of different blood sugar imbalances, different organ systems, even infections within the gut that can significantly affect that. So in July, I'm doing an MTHFR training. A private healthcare group has invited me in to train their healthcare team on MTHFR. Next year, I'm speaking at a conference that usually is not in the St. Louis area. It's a natural fertility group. I don't know the exact name of them or their model. And they're bringing the conference to St. Louis next year. I think it's only for healthcare providers. So I'll be sure to share that information if it's open to the public. I am always teaching, and the reason I accept these teaching gigs is because it gives me a chance to get my hands on the latest science and research and data and statistics, and it keeps me learning. It keeps me excited about what I do, and it gives me the resources that I can share with you guys, right? I share this with my clients that I work with one-on-one, but when you guys have access to learning this information, and if I can point you in the right direction to the right testing, to the right do-it-yourself programs, that's where I really get fulfillment, because I feel like I'm empowering you to take charge of your own health and not feel like your health, your health and you being healthy and your health care is in the hands of somebody else, because that's not really an empowering position to be in. So thank you again, and feel free to post some of the topics that you would like to see more information on.